Even though she's unconscious, and I know that the way that you guys have done mouth care in the past is having their head fully up, but we are going to have her head down because we're going to turn her to a side-lying position. Okay, so her head, she should be facing me. So I'm going to use that draw sheet that's right here, and I'm just going to pull the draw sheet this way. I'm going to put the pillow behind her back, so that she stays in that position. Okay, her back against there. Okay, I'm gonna put my gloves on. I'm gonna have the emesis basin and the towel right underneath her chin. Can you see? A little bit of water in here. That's from my swab. Okay, and we'll put this emesis basin right about there. Okay, I'm going to hold it whenever I'm using it. So I'm going to hold her mouth open with 2 tongue blades, because 2 is better than 1 because it's stronger. And I'm going to clean her entire mouth, if I can ever get this open. There we go. I'm going to wet this first. So that's why I got the water. So I'm going to wet this a little bit, but see how it's kind of dripping? I don't want it to be dripping, so I'm going to kind of squeeze out the water on the sides of the hair because, you know, she's unconscious. I don't want to be putting water in her mouth. Okay, so I'm going to hold her mouth open with this tongue blade. Yes, if you need to come around here so you can see, put that right on your tongue. And I'm right-handed, so I'm going to hold that with my left hand. I'm going to stick this in her mouth like this and brush it just like as though it's a toothbrush. Okay, if she has her own teeth, you still want to be able to brush them and get the whatever crud off. Okay, so brush all the teeth around the lips and the gums. Okay, sorry, am I gagging you? All right, make sure you get the top, the roof of the mouth, and make sure you get the tongue real good. She's not gonna be able to stick her tongue out, but her tongue might be all kind of, you know, crusty and stuff, and it might take you a little bit to kind of get that crust off. You might need to rinse this out again. All right, and so I got the tongue, I got everything, got all the surfaces, and I'm going to get her lips. Okay. All right, so then afterwards I'm going to have, this is my, what am I supposed to put on her lips?
Olive oil or
petroleum jelly. So this is my petroleum jelly, and I'm going to put this on her lips just like that. Okay, make sure I dry her face off if it got a little bit of water on it or whatever. Okay, and then I'm going to clean up my area. All right, dispose of my equipment. So after I'm done with this, and the swab, I would throw it away in the garbage. Okay, I'm going to go ahead and reposition her for comfort. Make sure she has her towel belt. I'm going to take these gloves off, wash my hands first though. Make sure the bed is low and locked. Put her head back up and record and report.